So, ladies and gentlemen, and thank you, organizer, to give opportunity to present our study result, and thank you for Professor Linhua, the nice introduction. Yeah, and I'm I'm not sure I can see him. So, and can you give me a microphone, and I can maybe stand here. Yeah. I have the same problem. Sorry, it's okay. So, I'm sorry. So, I will give a brief introduction of the new generation and NNRTI and created by China. I think it's very important for HIV treatment history. So first of all, I give a brief the background of the treatment. So as you know, the HIV and AIDS epidemic and critical still critical in the Asia Pacific, with the UNAIDS establishing 95% target and to optimize the HIV care. So right now it's a INSTI-based ART highly recommended as a first-line treatment globally. And the STR, the single treatment regimen and reduce the pill burden and increasing the adherence, but we still have some challenge of INSTI-based ART and the cardiometabolic risk associated with untreated weight gain and dyslipidemia. So in Asia Pacific, of the highly metabolic symptom and the risk is greater and weight gain was seen in the Asia and AIDS patient on INSTI-based ART, and greater weight gain was also significantly associated with metabolic symptom. And compare with the NNRT-based ART and the people living with HIV with INSTI-based ART has more evidence of dyslipidemic. So a non-INSTI and based ART is warranted, especially for AIDS Asia patient. So in the China AIDS AID and the pharmaceutical company has created a new generation NNRTI. And as you can, oh, sorry. Well, and the first stage is a tablet. The name is ainuovirine tablet, and it's a separate tablet. And using the ainuovirine plus 3TC and TDF, and it's a whole regimen. The second stage is a single fixed dose, and using the 3TC and the TDF and ainuovirine together. So in the first stage, and it's a clinical trial for the native speaker. Oh, sorry, the native and AIDS patient, and we compare with the efavirenz. And efavirenz, 3TC, and TDF is a very classical regimen for HIV treatment. And the efficacy is non-inferior, but the safety is much better, and especially for CNS and toxicity. So phase 2 stage is fixed dose, the 3-TC, TDF, and ainuovirine together, just like the one pill. So in phase 2, and we also conduct another phase 3 clinical trial, and we compare with the INSTI-based ART. Just like I mentioned before, and INSTI and the ART-based is more and a recommendation globally. So, and this is I think it's very important clinical and trial phase 3 study. We recruit 762 and subject, and age is 18 to 65 years old, HIV positive, and all of the patients received ART before, and HIV RNA is less 50 copies, and the first and endpoint is week 48. We compare the two groups, and the clinical group is ainuovirine, lamivudine, and TDF fixed dose, and plus the EVG, cobicistat, FTC, TAF placebo. The control group is EVG and fixed dose plus ainuovirine and placebo, and then open, and all of the subjects switch to ainuovirine, 3-TC, and TDF. The primary efficacy endpoint is HIV RNA over 50 copies, and after the treatment 48 weeks. And the key secondary efficacy endpoint is a proportion of the subject with HIV RNA less 50 copies. And the safety endpoint is clinical and laboratory safety evaluation. And this slide show is all of the patient and demographic and baseline characteristic. The right is treatment group, and blue is a control group. And we compare the age, male, BMI, and CD4, and viral load, and others. And you can find the two groups no significant. And the result, and we very exciting, we can find the proportion of the subject with HIV RNA over 50 copies. The clinical, the study group, only 1.8%, and over HIV RNA over 50 copies. The control group, only 1.6%. And estimated treatment difference just 0.3%. So in these both of the group, and is very successful for the HIV separation. And the second is CD4 count. And it's a change from the baseline in CD4 count. We can find the two group is no significant. P-value is worth 0.602. And another analysis has done is a response rate for the CD4 count. And CD4 increase over 100, or is a CD4 increasing over 30%. And also find no significant. And the last thing is the safety. You know, in the ART is a lifelong. The safety is very, very important. And we can find both arms were well tolerant, and most AE was mild and moderate. The SAE in both the group were unrelated to the study medication. The manifestation of AE in the two arms are similar, but the incidence of ADR and the AE grading 3 to 5 on the ainuovirine group were lower than the EVG group. The incidence of the metabolic related AE and deadness with the clinical group was lower than the control group. So, and after the institute and based the treatment region and the weight gain and the lipid are very concerned, and we special and compare the two the indicator, and we find the proportion of the subject of weight gain of clinical group was significantly lower than the control group. There was no significant change in body weight of the two arms at the week 24. From then, and we can find the body weight in both arms increased slightly, but the weight of the clinical group was significantly lower than the control group. So, we do the 48 weeks analysis about this lipidemia, and we can find the blood lipid decrease significant compared to the baseline with the clinical group, and the lipid was a significant increase than the baseline in the EVG group. Okay, sorry. This is very important. It's ASCVD associated and this lipidemia. So, so just 1 minute. And end of the 48, the incidence of ASCVD risk associated with this lipidemia decrease with the clinical group. And renal and other system dysfunctional and associated AE show a similar profile between the two groups. So that means the AE is a very safety, the summary, and ainuovirine and tablet and ainuovirine in the fixed dose is compared to the efavirenz-based and the institute-based regimen in treatment-naive and virological suppression in the HIV/AIDS patient. And the ainuovirine and the ainuovirine fixed dose are clinical advantage in the CNS toxicity and the body weight and the lipid metabolism. In considerable of Asian patient with a high risk of the metabolic system and the cardiometabolic condition, and the treatment, the new medication is a favorite the recommendation regimen. Thank you very much.
Yeah.